Okay, so here we go. So welcome again to our update, and our first presenter is Huckleberry Youth Programs. Priscilla, take it away.
Great, excellent. It would have been so nice to meet everybody and be in person, but taking advantage of the fact that we're all here together is really great. Nice to see a lot of folks we already know. So really quickly, we do have a lot of different programs. These are generally the areas. We still have our Teen Tuesday Clinic, which is kind of the most known in the county, Tuesdays from 1 to 4:30. That program also has health education available on site, as well as STI and pregnancy testing and options counseling. And we have a therapist on site every other week. We hope to be back to an every week basis starting in January. So still working through a little bit of that. I'm working my way, what is that? Clockwise, I think. Health education workshops we also have in the county. Those we are doing in combination with middle schools and high schools. We do the majority of that for the public schools here in Marin, as well as a few private schools. So if anyone is interested or wants to talk about the curriculum, let us know. That's California Standards Plus, as I call it. We include conversations around rights, respect, responsibility, and consent as well. So those are a little bit more additive. We also have a college access program for first generation youth that we've had for quite a while here in Marin, maybe less known, but that is for currently we're 9, 10, 11th, and our 12th graders are closed. That is a cohort model, and we do take them through the entire 3 years. We also have mental health and substance, including therapy, brief intervention, outreach and substance at SR, and TAM Union. I forgot to include that as on the slide. We also have expanded our newcomer support this year. We have a specific program addressing peer health leadership called Nuestra Salud. And we have a psychosocial groups at SR and TL called charlas, and those are embedded during the school, during the regular school day. Now, could you advance to the next slide just really quickly so I can have everybody know how they can access our information. So depending what you're interested in knowing more about or connecting, there are a few different ways to be in touch. Most of that right now is through email. So either the mental health email, the ACE Academy, or the Teen Clinic. Teen Clinic is the only one different. We are more active on Instagram and trying to stay active and relevant and put a lot of great information out there. That number that's on there for the Teen Clinic is also our direct line to our coordinator, who can field questions from clients as well as make appointments through that line. One thing I did want to highlight is that during our clinic, for reproductive and sexual health services, that's 12 through 21. However, mental health expands to 25. So that's still available for older TAY youth. We are back to a drop-in model, so that is available, but we are closed for the holidays. The QR code works, so I'm assuming we'll get the slides later on. So if you're interested in having a young person apply to the college access program, just have them click that and it'll take them right to the application. And I think that's it for now. For mental health, we do have a wait list at this moment, but definitely contact that email or myself. If you call that main line, you can ask for me or leave a message for me, and we'll do our best. But again, we hope to be back to our regular capacity later on in January or early February.
That's great. Thank you. Now we have North Marin Community Services, Chelsea.
All right. Hi, everyone. It's so nice to be here, and it would be wonderful to be in person, but definitely love that we're able to come together in this way. I had sent a slide that was a great resource that I'm hoping to hand out. Beautiful. Of course, at North Marin Community Services, we have a lot of different programs. And so I thought that I would kind of cover this flyer that actually one of the schools that we are contracted with had requested us to create something like this that they could include in their yearbook. And so a couple of the schools in Novato have this in their yearbook, or actually not their yearbook, the planner that they all receive at the beginning of the year. So this is something that's available for distribution. And we also have a version in Spanish as well. So you'll be receiving that later on today. I'll cover a couple of things that we are able to provide in North Marin. We've got school-based mental health counselors serving. We serve elementary, middle, and high schools. Novato High School is the one high school that we serve here, and all of our services are pretty focused on the area in North Marin, so Novato and parts of West Marin as well. The Novato Teen Clinic is something, it's not drop-in. We did have to shift during COVID. And so we used to be available Wednesdays as a drop-in model, and now we're doing appointment only on Wednesdays. However, we do have a bilingual wellness coordinator there. So if we do have students or youth who come to the clinic between the hours of 1:30 and 5 p.m. on Wednesdays, there is someone there to meet with them, screen them, and either see if there's availability that day or get them scheduled for an upcoming Wednesday. And so we partner closely with Marin Community Clinics so that those youth are able to receive reproductive health services and STI screening. And throughout the week, what has also changed due to COVID is that we're able to provide virtual services as well. So mental health services can be provided virtually Monday through Friday, and so can case management services, as well as reproductive health education. So if any youth age 12 through 25 wants to be connected to any of those resources, they can call or text the teen clinic at that number there. We also have the QR code where you can actually scan and take a look at a little bit more information about how to be connected to services. So that's a big shift for Novato Teen Clinic, is that, again, so our reproductive health services like getting an IUD, birth control, or STI screening, that all happens just on Wednesdays between 1:30 and 5. And then the other services are available throughout the week, Monday through Friday. So it's been really helpful to be able to have more access in that way for our youth. And then we also are continuing to do outreach through social media. And this year we're able to do a little bit more outreach in person as well. So as conditions continue to improve, we are hoping to have all of our Novato Teen Clinic providers back on site and eventually move back to a drop-in model. But for now, we really are going to be continuing to do the appointment only. And at the end of this month, we're going to be open December 22nd, and we plan to close December 29th at this time. Just to sort of wrap up, we also have community-based services. We have sliding scale. We also have a contract with the BHRS. And so through a referral, we can meet with Medi-Cal. However, there is a process for this. And so if there are individuals in the community, again, it can be youth or any age, or they want to get connected to any of our mental health programs, it would be great for everyone to contact that number just there where it says Mental Health Navigator, which is the 415-892-1643 at extension 239. We have a bilingual mental health navigator who's able to receive calls throughout the workday, throughout business hours, and we can really work with anyone in the community to kind of get them set up to where they might need to go. And so that's a really wonderful resource. So again, since we have so many different offerings, you can always reach out through these numbers, and we'll have people who are responsive to the needs of everyone. And I think regarding any eligibility criteria, again, we've got different levels for depending on who is seeking services, but 12 through 25 through Teen Clinic, and then through our agency services, we can kind of serve a breadth.
Thanks, Chelsea.
Thank you.
Now, continuing on with our health-focused part of this panel, we've got Danica with Oral Health Program.
Great. Hi, everyone. This is my first TAY meeting, so I'm happy to be here. So I'm just going to go over a quick overview about the Marin Oral Health program and kind of what we do. So we were funded by Prop 56 to create an oral health program, and we're specifically focused in oral health education, dental disease prevention, and if able, linkage to treatment and case management. And the way we do that is we focus on 3 core areas. So access, education, and communication. Next slide, please. So these 3 focus areas are kind of what we focus our work groups on. So access, we're focusing on ways to make dental care more accessible in Marin County. So while we're not directly providing services, we are working with our FQHCs in the county, a few private practicing dentists, as well as the Marin Dental Society. And what we do is really provide a lot of resources and advocacy. So if a community member comes to them or us and is wondering how to find care or how to sign up for health insurance, we do provide a lot of that information on our website. We also can link them up to the different dental clinics in the county, as well as other resources like through Medi-Cal. So we are really heavy in resource and advocacy in that way. And some of our activities include the things I mentioned, also creating and providing resources to finding care, hosting informational webinars, and also hosting school-based schooling dental programming. So one of the programs we created before COVID put us on hold from in-person stuff is we were starting up a dental screening program for in-school kindergartners through 5th graders. But hopefully with COVID hopefully with us being able to be in the community more, we're working to start up those dental screening programs and, you know, increasing our presence in the community. We also focus on education. So we're focusing on increasing oral health education across the county. And this one, we do provide direct services and education to community members. So one of the things we've created was a community health worker train the trainer webinars where we're training and coaching community health workers and promotoras in how to be able to provide oral health resources and education to community members. We also provide them with a toolkit that they can use while they're educating in the field. We've also started an educational dental fair where we have different education modules to engage with, and it's all student-based as well. So we get volunteers and we go into schools and we have the students interact and learn about how to take care of their oral health, essentially. We also do in-class education to students as needed. We actually had, on Monday, we presented to 6th to 8th graders at Davidson Middle School and provided some oral health education tips and tricks and some facts. We also do education training with partnerships, such as with Dominican University. We're working with a few of their nursing students and training them essentially to be able to be an advocate and train them in how to talk about oral health and give oral health resources and training and having them go out into the community, into classrooms as well. And the last bit we do is communication. So we're focusing on increasing oral health communication in the county. So including education, again, how to receive resources and care. And we do that through a number of ways, such as really engaging in social media. We are using our Facebook as well as our website, and we're using on occasion Health and Human Services Facebook and Instagram pages as well. We also are engaging in local media such as the Marin IJ or regional newsletters such as the San Geronimo Stone Soup. And we also maintaining, like I mentioned, a robust resource heavy website, and that's at marinoralhealth.org. That website is designed to be a community toolkit. Specifically under the community toolkit page, we have a lot of resources that are downloadable for the public, including any type of education material that we create. We also share a lot of infographics and news articles from our community partners as well as on the state and the government level. And all of our resources are available in English and Spanish, and especially the ones that we create, we can translate them into other languages as well. Next slide, please. Thank you. So COVID kind of put a halt to in-person work. So we had to pause in-person activities such as dental screenings. In the past, we also put a halt to other CHW trainings that were in person and planned CE trainings for dental providers, as well as in-person meetings. However, you know, we've been able to really adapt. We've converted all of our community health worker train the trainer seminars to an online webinar series with a specific training focusing on school-age children. So hitting that teenage population, talking about teenage specific oral health problems and tips and tricks, as well as some information like that. We've also converted all of our meetings to online so that none of the work gets dropped, so that we're still engaging with our community members and putting a finger to the pulse in the community and what those oral health needs are. We're also given the okay from our state office to really support higher risk students with things such as dental activities, such as like the dental fair or an increased educational webinars, as well as with dental kits if needed. And we're also increasing avenues for communication and civility to bolster our online presence and resources. For example, we are working with a high school student right now as an intern, and she created a teen-based survey that we're sending out to a few teen and youth organizations in the county, where we're going to kind of get a feeling for what the oral health education level is, their knowledge and background of oral health issues in teenagers, and kind of seeing what their behaviors are, such as surrounding lip piercings, and gauging their knowledge behind how those affect their oral health. And with that, we're going to convert that into oral health messages that are educational and posters that we can distribute to schools and that we can post on our social media to engage teen populations in our county and really get them thinking about their oral health. And next slide, please. So some of the resources we have, I would definitely say check out our website. It's marinoralhealth.org, specifically the Marin Oral Health Community Toolkit page. As I mentioned, we have a lot of downloadable resources for all ages, include especially teens. All of our materials are in English or Spanish, or if there is other languages that are needed, just let us know. We can get those translated as well. We also have a Facebook page, Healthy Smiles Marin, where that one we share more newsworthy articles. So news that we see in major publications, as well as on the state or government level. And last slide, please. So if anyone wants to be a part of our oral health work groups, you don't necessarily have to be in the oral health space, but we definitely welcome anyone to join our oral health work group to help us, tackle oral health problems and move those metrics in the great direction. So feel free to email me or give me a call at my office number. Thank you.
Thanks, Danica. That's great to hear an update about all those great things going on with that program. I have not been tracking it over the last year, so that's exciting. And now we also have BACR to talk about tobacco, our favorite prevention topic.
Hello, everyone. My name is Syra Soriano, and I am a tobacco health educator for Bay Area Community Resources. And I work very closely with the Marin County Tobacco Control Program to help carry out the different objectives in the program, of which I'll explain now. I'll explain it now. So here we have, we're finishing our grant cycle, which had different priorities, and we're starting our new 3-year cycle come January. So the way and the priorities that we have that I'm going to describe right now will describe the work that we've done. And we're going to start shifting and transitioning into our new plan, but we're still going to be providing close to the similar services and have similar objectives, which have included to reduce exposure to secondhand smoke, tobacco smoke residue, tobacco waste, and other tobacco products. Also to reduce the availability of tobacco, limit tobacco promoting influences, and promoting tobacco cessation, and helping to facilitate youth engagement in tobacco control, as well as for adults. And let's see here. So the way we've done this is from my end is to provide tobacco prevention support through educational presentations and trainings in the community, both in English and Spanish. For this could be done through after-school programs or through community-based organization events. and then also to promote youth engagement and tobacco prevention efforts in the county through our internship and volunteer program that we call the Youth Advisory Council. And they have an Instagram that I'll include in the chat, as well as some cessation resources. But we work with these youth, this group of youth, and provide them internship opportunities, which they could receive credit for as elective credits in their high schools, and provide some opportunities to engage in tobacco prevention, outreach opportunities, and also to collaborate with community partners and different community-based organizations to carry out any substance use prevention or tobacco-related projects to increase education, awareness, and resource awareness for the community and for youth. And they've been engaging in different policy advocacy work as well. Specifically in the last, I would say since May, there has been 4 policies that have been adopted, all regarding secondhand smoke in multi-unit housing. Just as an example, where students have learned about this issue of smoking in apartments and multi-unit residences, felt very strongly about the inequity revolved around that issue, and have decided to take action. And we've just helped provide them education and resources for how to engage with the community and to create change. So I will also be providing a flyer for how to apply or how to join this internship or volunteer program. And so, yeah, I'm sorry I don't have any visuals, but I'll be sure to get them to you. Thank you so much.
Thank you. That's nice to hear that update. So next we have the SPAR Center for Mario.
Oh wait, I have Jessica Colvin with TAM.
Oh, Jessica, yeah, right. I'm sorry. I wasn't seeing what was right in front of me. Jessica.
Hi, everyone. Can you hear me? Thumbs up. Yeah. Okay, great. Hi, I'm Jessica Colvin. I'm the Wellness Director with Tamalpais Union High School District. At TAM District, we have 3 comprehensive wellness centers for students ages 14 to 18, where we provide health services, mental health services, substance use and misuse services, as well as sexual health services. We partner with many of the folks who are on this call. We have a drop-in center where students can self-refer and refer a friend. We have systems for staff to refer students, as well as parents and caregivers. We do all of our work on 3 tiers of support. So we do programming for all students, for some students, and for the highest need students. We do a lot of connecting to community resources. We want students to learn how to navigate the mental health and health systems in Marin County. We don't want them to become dependent on us to be their only source of care. We have a lot of providers who do one-to-one for mental health, for substance use. We have a sexual health clinic in partnership with Marin Community Clinic every Friday. We have a condom availability program. We have a partnership with Huckleberry where we have substance abuse counseling on campus. We have a pretty significant tobacco use prevention program on campus where we have site coordinators at each school who bring in youth to teach their peers about tobacco prevention. And I will drop in the chat, we during COVID transitioned to an online virtual wellness center, which is really awesome. And I'm going to drop that in the chat. Thank you.
It'll be great to see all these new resources, all these new virtual resources that we have now due to COVID. We all got around to doing what we thought we would do virtually, right? Putting all these things together. So it's great. Now we've got the SPAR Center. Romario, sorry. There you are.
No need for apologies. Yeah, so I sent a little update from Phil into the chat. I'll try to send it over again. Some updates on the harm reduction end. Right now, I'm working on enrolling some clients into health insurance because the 340B program, which is the funds that we've been using to get people onto PrEP, which is pre-exposure prophylaxis. It's what prevents the transmission of HIV. We've been using those funds to cover the expenses of PrEP coverage, but now those Gilead is canceling that program. And so we've been trying to scramble, but I think we have finally found a really good solution. And that solution is working with this organization called Pride Life. They have a history of working with LGBTQ plus community members in a community-centered way. And so we are enrolling people into health insurance plans. And so a benefit is that our clients get to enjoy having full healthcare coverage. Unfortunately, we can only cover the copays for PrEP and STI screenings and testings, but we do pay the premiums in full. So they only pay for the copays for other services. If you have any LGBTQ plus community members, particularly people of color, men who have sex with men, I would really appreciate you to connect me with them. I'll send in my communication methods into the chat. And that's about it. We also still have our harm reduction team hitting the streets and visiting communal gatherings and stuff to ensure that people get needle exchange processes. So if you have any questions about that, you could also hit me up and I'll connect you with Chris, who would be a good contact for that. Thank you.
Thanks, Romario. Good to get the update from the SPAR Center. Now we're kind of moving into some other topics, a little more away from health and wellness and into education. So we've got College of Marin, Psychological Services, Stormy, and Anisha.
Thank you and good afternoon. Again, I'm Stormy Miller-Sabia. I am Director of Student Services with Student Accessibility and Psychological Services at College of Marin, and largely am joined by my colleague Anissa Rosa Sanchez, who is one of our licensed clinical social workers within psychological services. And we'll focus more on these two student support services at COM today. And I do want to just say before we get into these services, you may be aware, but if not, for individuals who are considering becoming students of COM, the spring semester is going to be free, so tuition will be covered. In addition to that, going from back to March 2020 through November 2021, for students that may have been enrolled and may have had any debt, there is the student debt cancellation for that period. And the goal is really to remove barriers to accessing education. So for those who had debt or have struggled with financial obligations that may have interfered with ability to enroll in school, this is a really good time to do that. And we have many of our courses that I think we're at a 75% plan for return to campus. So there still is an opportunity for students to engage in online learning. But for those that have found it a struggle to really engage in the remote environment, there's lots of opportunity to be back on campus in person, accessing academic supports and student supports face to face. So I just want to share that as we move forward. Regarding our psychological services that we have at College of Marin, we do have two clinicians who have been providing services to our students during this time of pandemic. Largely our services have been provided via telemental health. So they have been virtual and we have not been providing these services on campus since March of 2020. There is a plan for some return activity, but we also acknowledge that many students may be looking to continue that telemental health opportunity. So both will be provided within our mental health services at College of Marin by Anissa Rosa Sanchez, and then also Danila Musante, who is our licensed clinical psychologist on campus. And we also have two wonderful clinical trainees who will be on campus and virtual in spring. and have been with us this semester as well. These services are available to any college student, whether you're taking credit or non-credit classes. They are free to students, and we try to make sure that students become aware of these services in their classes. Our faculty make students aware in their syllabus, our support services on campus. We really do want to promote the health and well-being of our student and campus community. And so students availing themselves to these services who may have challenges with accessing community services should know that they're free. We do want to also make note that a lot of times you'll see on college campuses that there's a model where there's a limit in terms of the number of sessions that one can access. That's not something that College of Marin has really adhered to. We want to make sure that students are served, and when appropriate, we can certainly refer, but know that there isn't a session limit as far as accessing psychological services. So these services provide an opportunity for students to be able to talk to someone who's listened and who's trained to help. And as I mentioned, they are free. And these are just some examples of the type of services provided: crisis support, assessment intervention, referrals to off-campus providers, and consultation, as I mentioned. Next slide. And this right here is really just a note that these services don't become a part of a student's academic record. If there's any concern around it being an educational record when you think about transfer to other institutions or beyond. And also this information is confidential. It's not shared with faculty, staff, or anyone else unless a student should wish and there's a release to be able to communicate with other support services on campus. The number to be able to call and request services is listed here, 415-485-9649. And we do have an email address. This email address isn't used to necessarily request services, but it is an opportunity if you'd like to learn more about beyond the individual counseling services. We provide a number of services. There's workshop opportunities. We partner with organizations like Side by Side and Art with Impact, and Anissa will talk more about some of our programming activity and safe spaces that we aim to create. And there's also a lot of community partnership. We have been working in the area of equity and mental health for a while now. And by that, we mean that we're really centering the mental health needs of our students, faculty, and staff of color. And so that is very pronounced in our work and our efforts, and we're very intentional in that way. And so I'll pass it on to Anissa so she can share more about the good work that we're doing as far as our student spaces and community activity.
Thank you, Stormy. So I'm going to speak a little bit just about our Equity and Mental Health series and our community partnerships. Equity and Mental Health is a partnership at College of Marin between Psychological Services and our Umoja learning community. And one of the groups that we have that's run in the fall and the spring semester for students is something called Call to Courage. And it's a weekly workshop for BIPOC students, Black, Indigenous students of color. And it's a space that provides a deeper understanding of how race, class, and health affect a student's life, community, and their educational experiences. It's had some good attendance and been well received on campus. And another group we have in the Equity and Mental Health series is a group, the LGBTQIA Two-Spirit Plus support group. It's a support group that's led by a facilitator, and students come together to talk about a variety of topics. And there you'll see some of them here on the slide are related to healthy relationship, college life, and chosen family, and it's a way to build community. And this group was also held weekly. Both Call to Courage and this group were held weekly in the fall and are typically held fall and spring. The last partnership I want to mention is a partnership with Art with Impact, which is an organization that promotes or uses the power of art to promote discussion around mental health. And so these are workshops that have been virtual in the pandemic, and they have featured award-winning short movies. And then there's an opportunity to have discussion and activities and dialogue that center mental health. And this fall, this workshop was actually brought into a couple of the classrooms, and it was very well received as well. And so Art with Impact will use a variety of different modes of art to initiate dialogue around mental health. So for example, we've also had a poetry for mental health as well, and we're continuing these partnerships with these organizations in the spring as well. And so a way to stay connected to the work that we're doing in psychological services is to get on our mailing list. You can email us. I'll put our email again out here in the chat, or there it is, thank you. And then I'm also gonna drop our, we have Psychological Services has an IG account, and that's such a great way to stay connected to us as well, to kind of learn about what's coming up and about events and our services. And so I'll go ahead and place that in the chat. Thank you.
Thank you. That sounds really cool. That sounds amazing. Okay, let's go ahead and move to Felton Institute. Natalie. Okay, maybe Natalie's having issues with her audio, so maybe we can go ahead and skip ahead to Behavioral Health and Recovery Services. Natalie, let us know if you come back. Send us a chat.
Hi, Matt Carter here. I don't think Lexi's on the call. I don't think she could make it, but ironically, I'm presenting for a YFS and Children's System of Care. I'm about a week and a half into this current role here. So
welcome.
So just on the YFS side, I think most of you either know or partner with or collaborated with Youth and Family Services. I put in the chat. We do serve children and families in Marin who are Medi-Cal recipients and offer a host of services. And those services are accessed through our mental health access line that does an initial screen to determine what level of service the kids need. And then we get referrals based on those initial screens. So I think that's all I'll share for now until if you all have any questions.
Thank you. I'm sure people do, but we're going to have to, since we have a packed agenda, we'll go back to Natalie from the Felton Institute, whose audio is on. Except for she is muted.
Okay, I'm back. I had, too many buttons. Okay, thank you. Sorry. So I'm Natalie Goujon. I just go by Natalie, and I'm the clinical team lead for our Remind Marin program. It is an early intervention for psychosis program in the area. I will just kind of briefly introduce, when or how you might run across that. For some of us, it's common knowledge kind of stuff, like just DSM kind of stuff. But basically, how it might appear to you with a client that you're not familiar with would be impairments, like a sense of, it could be just something as simple as disorientation. And then, when you inquire, you discover that they might be having symptoms that actually impair their functioning, such as disorganization, and it could be as severe as obviously a hallucination type auditory or visual input. A poor communication is another symptom. I like to introduce our program this way because it is very specialized, and that's really who we serve, and it does require ideally early intervention. So that's why we deal with youth, age group between 15 and 30. And we do want to catch it early because it's been known to be extremely successful. If you let me know when 5 minutes is up, by the way, because I know you guys have a real time crunch, and I didn't really time my little spiel here. I'm just impromptu here. But if you suspect that someone's had symptoms along the lines of this, it could be something such as executive impairment, memory, but compounded with, unusual thinking, particularly. So if that stands out to you and someone has those symptoms for a couple of weeks, they can call us directly. The phone number was on that first slide, and I can put it in the chat. It's my direct line. So I'll be glad to at least consult to determine whether their needs are pertinent to our organization. Our program is in 5 different counties. It's with the Felton Institute, and so it's been shown to be very successful. And user friendly, so that there you go. And our clientele has to have Medi-Cal at this time and be a county resident, and has had to have had the symptoms that we're referring to fairly consistently, say, like I was saying, for maybe a couple of weeks, maybe on and off, but within about 2 years of contacting us. So fairly fresh, because that early intervention, again, can facilitate real intercepting real severe symptoms and longer term symptoms. And we use therapeutic skills and case management, as well as family intervention, peer support, and we are able to sort of capture some of the inner processes so they can be intercepted before they become more severe. We also use really custom medication support, which is geared to maintain cognitive skills, so that they can, so that our clients are able to manage and maneuver the world they're in and not become incapacitated by the illness. So I'll also say that for referrals, so there's not a slide for that. Thank you for trying to keep up with me on that. There is primarily our path is through access, or if the client already has mental health services in the county through a county provider, the referral can come directly to me through that provider, and we'll be glad to do an in-depth assessment and screening as well. And move them forward into this treatment, which is, I want to say short-term, 2 years, but can be very, and it has a great effectiveness. And at which point we would do a longer-term referral and a warm handoff, so that the client's symptoms are managed longer term. And I'll put my phone number in the chat for any questions as well. I think is there one more slide? Yeah, I think that's the general gist of how we process our clients, and are happy to hear from you if you have any questions or referrals that I can help process and make sure that they get the best services. Thank you.
Thank you. It's very interesting service model, and it's good to know that it is out there.
Pleasure.
Now we have BACR with the Adolescent SUD Program.
Hello, everyone. Hello, esteemed colleagues. My name's Leslie Miniweather. I'm a clinician, therapist, and counselor, SUD counselor with Bay Area Community Resources Family Connections Program. We've been around quite a while, and we're actually the only drug Medi-Cal program in the county. And I'm it, basically. So I'm just going to go through this little list that I got. So basically, we offer substance use education and support okay, I'm saying too much. Substance use and support. Here's our little flyer there. We partner with quite a few resources within the county. Our referrals come from Youth and Family Services. They come directly from therapists. They come from self-referral from parents. Basically, anyone can pick up the phone and call me if they feel like their child or their client needs substance use disorder treatment. Our age range is, of course, being adolescents, is from 12 to 18. The 18 age is, we work with that. If they are coming in at 18 and they're still living at home, still in high school and so forth, I would do an assessment and or intake. Let me see. And they can walk in, but unfortunately, there's no one at the office. So we're kind of doing a hybrid situation right now. So calling me and letting me know that you have someone that you want to refer is perfectly fine. I am doing in-person assessments depending on their vaccination status, unfortunately. But I am holding in-person assessments, ASM assessments. We are located at 171 Carlos 5, which is really close to a lot of different things in the county. It's close to probation, which reminds me that a lot of our clients are on probation. That is one of our biggest referral sources, is from Marin County Probation Department, Juvenile Probation Department. And so the eligibility criteria, basically, we're drug Medi-Cal, so they must be on Medi-Cal or partnership. One thing that I also want to add is that if they are uninsured, we do take uninsured clients as well. If they are not able to get Medi-Cal and don't have any insurance, we take uninsured and drug Medi-Cal. I don't speak Spanish. I speak it. I understand more than I speak, but I have a wonderful partner that I work with, and everyone knows them, the Multicultural Center of Marin. They do a lot of my translation for clients. It just seems to work. I'm able to get the translation done. And if in fact the parents are not available, of course, kids can consent for their own treatment. So they can come in and have an assessment, an ASAM assessment, without their parent or caregiver. Let me see. Key outreach staff, me. We also go to the schools. I'm in the schools, and I'm actually really, really looking for more referrals from the high school psychologists and clinicians and whoever else is whoever else is working in a mental health capacity or a form of substance use lens. I'm really would like to get some of those referrals from the schools. So I'm going to be doing a lot more outreach to the high schools. I do work with the Marin County High School, but that's one of my goals as soon as, things start lifting even more. Let's see, what else? What are the times? All the time. No, basically I work from 10 to 6. Those are supposed to be my hours, but not really. I work on Saturdays doing volunteering. I'm just starting to do volunteering with the food distribution with Marin Multicultural Center. And so I take food to clients if they need it, and their families. I do family work as well as individual work. So if you have any other questions, I left my number in the chat, and I can also, and my email, and I can also leave any other information you may have. Okay, I think I went over 5 minutes, but it's a pleasure to see everyone here. Thank you.
Thank you. And your enthusiasm about your work is coming across through Zoom.
Oh, I love it.
So
I love it.
We have got 2 more presenters. So if people can stay on so we can honor that they've come in, to present us, that would be great. If not, we do have a recording. We'll record and send out available if you have a hard stop at 2. So we're just asking for 10 more minutes so we can hear about Marin 9 to 5, which 9 to 20. I'm sure that happens all the time. 9 to 5, 9 to 25. Okay, Marin 9 to 25. Nancy, Samantha, no.
Yes, thank you for having us. And I think this is actually a really good order because we're in 9 to 25 versus a program or a service offered to youth. It's really the umbrella. It's really a collective impact that's designed to bring all of us together to talk about what we offer and where we need to partner and where the gaps are. So just quickly to define, and I recognize a lot of you for coming to our meetings. We're an action-oriented collective of youth and adults dedicated to realizing positive and equitable outcomes for youth aged 9 to 25. And really, we want to make sure that all of our young people can meet all their needs, whether it's physical, mental, or social. And this effort actually started with Mo, Sam, myself internally at the county, realizing that we were kind of working in silos and kind of stepping all over each other. And that effort has grown to expand into our community. And so our goal is to try to connect us all. Our principles guiding our work is a shared agenda. We share the same vision, problem statement, and approach. We coordinated our activities and communications among ourselves. And this meeting is super helpful. We align our understanding of youth needs and measurement. So we're talking about the metrics that we use, and we're all kind of on the same page. Prevent duplication of efforts, so not too many services in one area and none in another. And ongoing public and private stakeholder buy-in, why the county serves as backbone, private organizations and key partners and CBOs. The way that 9 to 25 is structured, it's not structured to take a lot of your time. Once a quarter, we have a meeting and bring all of us together where we have a really pretty healthy attendance at our meetings. And that meeting will have keynote speakers and presentations and like what we're doing today. So it's really strategy, decision-making, and knowledge sharing. And then there are 3 working groups that Sam and Mo are going to take you through, which are more short-term. There's a goal, there's a project, and working with people that come to those steering committees to get that work done. Next slide. I'm handing it over to Sam. Oops. I think, go back 1 slide, if you will. That one. Thank you.
Okay. And so I'll talk about our first 2 groups. And this really is, the goal is to bring together people such as yourself who are very invested in youth, and then cross silos and share and articulate. I think I've used the term support group, networking, articulation to describe what we're doing. And I thank those of you who have joined us. We have 2 active groups that are really about bringing together our collective impact and pulling together our voices, our perspectives, and our opinions to make change on issues that are emerging, that affect us, and that many of us who are direct service providers or administrators just don't have the capacity or bandwidth to run down on our own. So as a collective, we create these work groups to kind of get together and have the power of all of our voices in one room. The first one is around the social health network. You may hear about the Community Information Health Exchange. There is a Health Leads and RCHC, Redwood Community Health Centers, is leading a 2 to 3 year project to talk about what is the Health Information Exchange and how does the community interact and connect. And at the same time, we see small referral platforms coming in and being pushed out by different entities. What does that all mean, and how do you navigate that either as a person in the community who's trying to access services, or as a CBO trying to figure out, do I have to get on this system, or what does the system mean to me, and how does it integrate with us? It really is a group to think about and hear from different platforms that are coming in to learn more about them and to figure out how we can leverage what is being pushed at us for our betterment and more efficient systems. The second group is our payer and funder group. This is all about sustainability and how do we create a system that supports on an ongoing nature all the wonderful programs that we seem to create in a grant atmosphere, and then worry about what happens after 3 years or 4 years of funding. Where does this go? So we really are focused on bringing in our private insurers, our partners from Kaiser, from Blue Cross. Yesterday was our last a work group. We had Partnership Health come in and present to us on CalAIM so that we can start to understand what does I'm going to forget the language now, but the community supports around that. And what does that mean from a funding perspective for an agency who is providing support services to a youth that's not currently identified as one of the services in the first issuance of the CalAIM proposal? And how do we get our voices and what our needs are here in Marin up to DHCS to help form and advocate for what our needs are locally. So you can really think of this as an agency agnostic think tank in a certain respect. It is a collective impact, and we're only as strong as the people that come to our table. So for these work groups, for those administrators here that are running programs, worrying about where they're going with their funding, please join us and add your voice and your needs to what we're doing. Then I'll pass it over to Mo for our third work group.
Awesome. And I know for the interest of time, you know, with our, in an ideal world with Marin 9 to 25, we're working along with our young people, our transitional age youth, and our adult allies. We would have young people doing this presentation, not myself or Sam or Nancy. With that being said, that with our youth visioning work group and our quarterly steering committee meetings, we are very intentional about the time that we're holding those meetings so young people can attend and young adults can attend. We're intentional that we need to make these meetings accessible, that we offer Spanish language translation in our materials as well. You know, if we're talking about the importance of health, safety, wellness, everything about young people, they are the ones leading this work. And so us as adults take a step back and support them. That's what really the youth visioning work group and essentially what all of this work for Marin 9 to 25 is. I put in the chat box ways for you to participate and learn more digitally, and we will pop in the chat box how you can connect with us after today's meeting. But really, the youth visioning work group is everything else that we've talked about, Nancy and Sam, but young people are at the forefront. Even as simple as our logo, the colors chosen with intention, the reason why we have certain taglines and why the group is called Marin 9 to 25, that was all vetted and co-created with young people there at the forefront. And so we invite you to attend or to at least learn more, and we're happy to do a roadshow and connect with your agency as well. If you go to the next slide, we have our quarterly steering committee meeting, and they're all themed. What's wonderful is that, you know, I think this upcoming quarterly meeting is through the lens of equity and the work that we're doing. Some of you will be actually speaking at that meeting, so we're excited. And it's really about action oriented and focused. You know, there is a long range goal. We're not creating programs. We are connecting and breaking down silos because everybody's doing wonderful work where they are. It's just a matter of making sure that the young people in our community and the families in our community know where to go to get those services. So we hope to see you at our next quarterly, and that's Marin 9 to 25.
Thank you. Thank you. It sounds like a very well organized effort, and I think I might be checking it out with all my free time that I have. But I really encourage everybody to join their group. And then we have one more presenter. Thank you all for staying on the call, and thank you to all our presenters in advance, because I think we're going to end quickly. And I just want to see Louis. Are you still there?
I am. You guys
Good
hear
to
me?
see you. Long time no see.
Yeah, I'm so happy to be here, and thanks for the invite. So my name is Luis Luciano. I'm the program coordinator for both the Youth Working for Change program and the Career Explorer internship, which is funded through the County of Marin's probation department. And Youth Working for Change, to start with that internship program, we serve justice involved and at-risk youth. Do have a budget to stipend youth and experiences through the program. We try to remove any and all barriers, workforce barriers. So if it's workplace clothing or providing transportation assistance, that sort of thing, we work with young people to try to remove those barriers and then place them in workplace settings so they could eventually build marketable skills and gain employment in the community. That is a year-round program, and it is again funded by the probation department. Youth will earn a stipend of $14 per hour, regardless of the particular setting. So if it's an office setting or a skilled trade, that or a community partner, that rate is the same. The Career Explorer internship, this will be the 7th year. I can't believe that, actually, now that I think about it, the Career Explorer internship. It basically was born out of County Marin's 5-year business plan several years ago. It's a diversity and inclusion program, and we introduce young people to careers in government, and we have expanded some of those site placements into the nonprofit sector. A lot of the participants a lot of our interns that participate in the Youth Working for Change program eventually kind of promote up to the Career Explorer internship. We do a comprehensive soft skills workshop, and the things that young people will learn in that experience will include resume writing, conflict resolution. We do interview prep. I do a public speaking workshop. We have a guest speaker series, which will include members of county government and the community, as well as private business sector. We do a women in leadership series. We throw everything at a young person to kind of make that path and to help aid them in a career choice, hopefully to kind of come and sign up here with us and become County of Marin employees. I'm hopeful that this year the Career Explorer internship is in person. We kind of have to see how things go with COVID. The first year of COVID was completely online. Last year was a hybrid kind of environment where we had our guest speaker series online, and then youth were actually out in the field on site. There were actually 3 levels of kind of participation. So the first level was that video kind of guest speaker series. The second level were pick and choose assignments on Google Classroom. And then the third level was actually the site placement. So youth would engage at their own level. I think this year will be more, hopefully in that traditional sense, where we have the sites and then we'll have a guest speaker series, most likely on a Wednesday. So that's pretty much it. I'm going to, I think I put my contact information in the chat. Feel free to reach out to me if you have any questions. Thanks again for having me.
Thank you, Luis, and good to see you. I'm mindful of time, so I just want to say thank you to everyone for all that you do, and thank you for attending. I think it was pretty successful for our first virtual networking event. Next time, hopefully there'd be some time for some actual more networking and not just sort of the popcorn, but I was great to get an update on all the resources, and I hope you guys found it useful. We will be sending out materials and also a SurveyMonkey evaluation, so please fill that out when you get it. And